All right, I think let's get started, and people are starting to come in. Welcome everyone to this fireside chat at EMW 2021 on inclusive finance and healthcare best practices from the European Microfinance Award 2021. My name's Sam Mendelson. I'm financial inclusion specialist at e-MFP. I'm part of the core award evaluation and management team, and I'm the lead author of the annual e-MFP publication on the topic of the award, which this year, as you know, is inclusive finance and healthcare. I'm proud and delighted to be joined by Chiara and Olga. Chiara is a former rater and one of the consultants who've supported the e-MFP team throughout this year on the management and evaluation of the award. Olga is a researcher in microfinance at the Yunus Centre at Glasgow Caledonian University. As well as being a subject expert, she was also on the selection committee, which is the penultimate of the 4 evaluation rounds that the applicants go through in this process. So thank you both. A brief moment of housekeeping. Please put any comments, if you like, in the chat, and if you have specific questions to us, then best to use the Q&A, please. Yesterday, we saw the plenary at which the 3 finalists were profiled, and a lot of the issues there were covered on the demand and the context, the challenges of healthcare. We're not going to retread that much today, and instead, we're going to focus on the non-finalists. There are 10 semi-finalists that are whittled down from what was this year 43 applicants. 3 of them became finalists, but then there are another 7. And these 10 total are chosen by the selection committee, not only for their quality and their replicability and innovativeness, but also, you know, what's interesting. And here you've got a diverse landscape of different healthcare initiatives within the financial inclusion sector. Only 10 minutes ago or so, we saw the winner announced, and that was Foncasé of Haiti. And congratulations to them for Boutique Santé, the initiative which trains doctors and nurses to train community health entrepreneurs to conduct screenings and provide education to largely women in the most poor areas of Haiti. And so before we move on to these, a little bit about the award and the 7 case studies we're going to talk about. Briefly, the award was launched in 2005. It's been annual since 2014. I think you know there's 100,000 euros for the winner, 10,000 each for the 2 runners-up. And what we try to do with it is to attract applications from organizations that are active in financial services around the world that are innovating in a particular area of financial inclusion. It's a very rigorous process. There are multiple evaluation and application stages, and there is real exposure that comes out of this for particularly the semi-finalists, and the finalists are obviously in events at conferences. We do offsite sessions, there's the publication, and so we really try to use this as a stool to increase exposure of them, but more importantly, the topic. So I'm going to talk for a few minutes just about the topic and also the publication that we've just published this week. And then we're going to present the 7 semi-finalists. We're going to take turns presenting them for a minute or 2 each. And then the 3 of us are going to discuss what we found most interesting from them. We're going to finish with some of the overall factors for success that were important this year. And then hopefully we'll have some good time for Q&A. So why does good health and good healthcare matter? This can be described as the health and poverty trap. Health allows education to play its key role, allows people to earn and invest and employ others. Without healthcare, the converse is true. If you can't stop minor health issues becoming seriously, help people to recover from shocks and afford it, then all other metrics of progress are really constrained. There are really 2 problems for the low-income populations of the world: typically volatile and precarious incomes, and secondly, the absence of high-quality universal healthcare. So they need not only access to healthcare, but the ability to pay for it. But paying for it is a 2-fold problem in itself. The actual access and affordability may be an insuperable barrier, But even for those who are treated and recover, the health shock, the financial shock from the health shock can really cast a shadow for years for a family and send them into destitution. And so what role does the financial inclusion sector have to play here? It can play an indispensable role in both the day-to-day medical spending that people need, but also smoothing and mitigating the financial shocks from health. How? In the paper, which the link is now in the chat, but you will have seen it elsewhere, there are lots of ways this can happen, from health insurance products, a lot of which Craig Churchill from ILO was talking about in the keynote previously, life, credit life, hospital cash, incapacity insurance, different types of savings facilities, credit facilities like emergency loans. Also, there are hospital pharmacy vouchers, remittances are an option. But crucially in this area, financial products are typically married with non-financial products and services. Education and awareness building, screenings, preventative treatments, distribution of health products, and many others, some of which we'll cover today. So here is the list of the 10, the semi-finalists and the finalists, which needs updating now to note that Foncasé was the winner. The bottom 7 are the ones we're going to talk about today. And so a little bit about this publication, which is a team effort by e-MFP and with the support of consultants and various experts we talk to over the course of the year. Each year, what we try to do is after the selection committee is over, we sort of go back and reread the 10 semi-finalists very carefully and try to tag or categorize what are the key elements of these 10. That's a very heterogeneous group. And from that, extract 3 broad categories of how these initiatives can be thought of. And then we put the 10 into these and present them. Now, there's always overlap. One initiative will have aspects of 2 or maybe even 3 of these, but there's always one element that really stands out. And this year, the 3 central chapters of the paper are preventing and treating illness, mitigating the risk of health shocks, and delivering healthcare to those who need it most. And so let's bring Chiara and Olga on. Welcome, thanks again. And as I said, we're going to take turns here, and Chiara is going to kick off by giving a short summary of Alamana Microfinance from Morocco, and then we're going to have a little chat about what was most interesting about it before we move on. So Chiara, please.
Great, thank you, Sam. It's a pleasure for me to be here and be part once again of this very interesting process. And as you say, this year the application and the project presented were outstanding. So let's get started with the first one. So Alamana is an institution in Morocco. They offer financial and non-financial services to excluded community in rural and urban areas. And they have a focus on vulnerable entrepreneurs. So they conducted a survey and they realized that most of their clients were at risk of healthcare shocks, and especially the low income couldn't afford a private health insurance. So in 2012, they partnered up with some assistants to develop a health microinsurance program to meeting the needs of the rural population. And what is interesting here is that it's a very simple single policy coverage that is very low cost, because it's like 1% of the loan installment as a premium that costs around €1, and allow the client to have a coverage for herself and her family for around 460 equivalent euros to cover the main things of life like childbirth, severe disease, and hospitalization and related expenses. And as I was mentioning, it's simple because the client can really onboard simply meeting at the branch of the institution, and the claim process, which is the most hard part of it, can be done through customer care officers as well sitting at the branches, but also for some specific claims directly at the branch, like childbirth, death, and invalidity. And I found them in a single product extremely interesting.
Thanks. Olga, what's most struck you about this initiative? What you found most interesting over the course of this?
I think it's just the simplicity of it, because microinsurance programs can become very complicated, very complex. Clients don't understand it, therefore they don't claim. and all these things happen. And it's just how simple it was, how straightforward for clients, which also is like in the take up on the number of people being covered and yeah, the outreach.
Yeah, and the insurance covers so many different life events, isn't it? They've really been, I think, ambitious here rather than, you know, just focusing narrowly on one thing. It made it as broad as possible. I mean, as you mentioned, there's the childbirth allowance and the first detection of a disease, invalidity, hospitalization. Chiara, is that what interested you, or something else?
Yeah, additionally, what is interesting here is the outreach, as Olga mentioned. The institution can provide this facility to all its clients in all branches, and is supported by additional agents, like in a number of 604, plus 75 mobile vans that allow, again, to ensure that the most vulnerable, the low income and the rural people are really served with this service.
Yeah, and Right, and I like as well how they've made efforts. I mean, I think since 2015 to extend it not just to the client, but spouse and children all the way up to 21 or even 25 years old if the children of the client are students. I mean, it's quite a comprehensive package, no?
Indeed, and allows, again, for deeper outreach and for serving the entire household needs, which is kind of unique.
Yeah. Yeah, I mean, I agree with all that, and also the predominantly rural base. And I was also impressed too by the simplicity, as Olga touched on, of the claiming process, right? Having a 24-hour call center, which is more than my insurance company here offers. The low needs for documentation and all the things that we know are barriers to access for excluded people. Yeah.
Hello, can you hear me?
What's happening?
Ça fonctionne encore chez toi?
Both in urban as well as rural and remote areas. So a strategic approach is grounded on credit, training, and health. And it's really important that they do measure health. It's being monitored as part of the KPIs. So whilst El Salvador has a public health sector free at point of use and they cover most of the population, they lack quality services. It is often saturated, access is really complicated, and it is not geared to treat chronic illnesses. So it is hard for most people, and particularly people like the clients of SA, to access medicines, tests, and treatments that they need at a particular point in time, because this is important for healthcare. And healthcare services are mostly offered in the capital as well, in San Salvador, whilst rural areas are not very well served. So the clients getting a loan from SA are automatically enrolled in their health program, and they can access free general consultation through SA's 2 clinics, health campaigns in rural areas, and 1 mobile clinic they're going to start right now with. And since 2020, they've started also with telemedicine. So clients can access also specialists and private screening tests at an affordable rate through partnerships that SA has with other providers. And then in terms of financial health products, they're also quite innovative because the clients can access something called MediCredit, which is basically an emergency loan product. And they offer medicine, tests, they cover hospitalization costs, etc. So SA also is offering an optional life and cancer microinsurance product in partnership with Pan American Life Insurance Company. And their health program is managed in parallel with a sister NGO they created in particularly to focus on that health program to support the activities of the MFI. And they're growing the program through that sister NGO. So, you know, a very comprehensive, holistic program. Nice.
Yeah, I agree. Chiara, what struck you about this?
I think what Avanza does really well is also the customer centricity of their product. I mean, they have a very strong attention towards quality of the service delivered, When they apply, they share with us a number of studies they did in partnership with local international university that helped them to understand what were the actual needs of their client and which impact they were creating. And through that, and also as the representative of Ancose said during the award ceremony, it's important to test, to try out, and to measure what you're doing in order to design your product to cater the needs of your customer. And this is, I think, Azay is doing pretty nicely, and they really invested into that, and the findings are really used to design better products.
Yeah, it's so integrated, isn't it? Like there are examples we see where it's a grant funded or a microfinance plus initiative that sits sort of parallel, and then you see initiatives that are really integrated into the core financial services, and this is one of those that's struck me. I mean, the partly it's the range of the services, right? I mean, unusual among the semi-finalists is how holistic this is. The emergency loan, the insurance, adapting with telemedicine as well. We'll talk a bit about that later, because that's something that so many of these have had to do in the last 2 years, is those who sometimes from a very low starting point have had to really pivot and adapt to ensure continuity of health services in a remote context. Yeah. Anything more anything you'd like to add on this one?
No.
Maybe one thing just to build up on what Olga said, that El Salvador struggle a bit for reaching the rural areas, and the medicine in remote area, the service is poor. One thing that Azay is doing starting from 2021 is this mobile clinic project, again, to try to deepen a bit the outreach. And I think this is also an outstanding intervention on their end, again, to be customer centric and to serve their client base in a proactive way.
Mm-hmm. Let's stay in the Americas and go to Avanza Solido in Mexico. And Chiara, would you give us a précis of their initiative?
Yeah, with pleasure. So we go to Mexico. Avanza Solido was founded in 2011, and again, they provide financial and non-financial services to excluded rural population. They have a focus southeastern region of Mexico, and specifically on women entrepreneurs. There is a strong concentration of their operation in the state of Chiapas, where there is a predominance of indigenous population and also a high level of poverty. Plus the health facility there are lower in quality compared to the rest of the country. And Avanza Solido again realized that there was a need for awareness on healthcare matters, but also domestic violence was a matter to be discussed, and they also witnessed an increase of domestic violence during COVID pandemic. So they started this awareness campaign and health check, specifically oriented to area where poverty is very high and health exclusion is greater. And they provide this base where there is no preventive illness like diabetes and hypertension awareness campaign, free medical consultation. There is also a dedicated program on maternity health that is called Salud Materna Universal, which allows women to get some tests, understand more about family planning. And what again is interesting here is a number of things. There are market studies, they try to understand again the client needs. They use the poverty probability index to measure the change they are creating their clients, right, and how they are lifting them out of poverty. And as well, they are attentive to the indigenous community with a sensitive and culturally appropriate medical service delivery.
Well, Olga, I'll let you kick off because there's a lot to say about this initiative, isn't there? But go ahead.
Yeah, there is. It's an excellent initiative. It's really holistic in a deprived area of Mexico where, you know, the predominance of indigenous communities unserved or underserved by healthcare centers, communities / professionals, whatever. Like they're just kind of pretty much abandoned. So the program is fantastic. It's holistic. It's comprehensive. But also, I particularly like the fact that they are very, very much culturally embedded into the areas in which I'm working with and the type of population. So I like that the services are free of charge, which is important, particularly for Indigenous communities, because sometimes they're not used to asking for these services themselves. So it's good that at the beginning, or at least they could, once they're introduced to the services, they're free of charge. Like, for example, the cervical cancer screenings. And I also like the fact that they're trying to break taboos in what are very traditional very traditional Indigenous societies, where, you know, maybe a cervical screening test becomes a family issue. So I like that. I like that they're very culturally appropriate, that they redesigned their healthcare program, or the health program, very much with their type of client in mind. Mm-hmm.
Yeah, I mean, on that cultural appropriateness thing, I was struck rereading this. There are some things that didn't jump out initially, but then you see, like, when they bring a new medical provider into their, you know, that they partner with, they actually send someone from Avanza Solido goes with, accompanies a client in initial consults to ensure that it is language and culturally appropriate to maximize their comfort. Because, as we know, the structural violence part of the anthropological part of this is that, you know, people are intimidated by white coats everywhere, and especially in these communities. And earlier I mentioned 3 sections of the paper, and that they get, these organizations get put into one of those. And this one is absolutely in part 3, which is delivering healthcare to those who need it most, because they really absolutely do reach the poorest, don't they? And also what's impressive is the gender focus. I mean, from the responding to maternal mortality and the domestic violence rates, it's very focused on women. Yeah. And also the other thing I think that got me is how comprehensive has been their attempt to adapt to the pandemic, right?
Yeah, I mean, they move on Zoom calls, they have Facebook Live, opportunity to, in WhatsApp messages circulated to clients, which is kind of a way to keep in touch with your clients, and is a way
but balanced too, because, right, like, they didn't move everything online. They've triaged those that cannot be adequately done in a remote context, and so they still do on-site visits with fewer frequency, but higher numbers of people that are being seen, and those that can be done online for the time being are being done. So I think that's very impressive.
Absolutely, definitely we see an effort on their end to, again, reaching their population in an adequate manner. And again, the culturally appropriate services, as you both mentioned, is very key of their intervention. And we see that's the same, I mean, several organizations have that. We've seen a second with Friendship Bridge, but also Crescer during, again, the ceremony was mentioning the same, how important it is to meet the client needs in an appropriate way.
Yeah, that's right. Let's move to the Philippines and CARD, and I'm going to give a little summary of this one. So CARD is the Center for Agriculture and Rural Development, set up in 1986. It was originally a social development organization. It's evolved in several iterations now to become one of the biggest and leading MFIs in the Philippines. There's CARD Inc., which was the applicant here, is actually an umbrella organization for 22 MFIs called CARD Mutually Reinforcing Institutions, and they have a focus on empowering underprivileged communities, women and their families, largely through access to different financial services, education, and community development. The challenge here is that people in rural and remote areas of the Philippines have significant healthcare access barriers. There are financial and travel limitations, low awareness about health and availability of programs, the lack of access to medical consultations, unaffordable prescription drugs for diseases for which they are highly effective, lack of information about how to use services and where to seek them. So CARD's program is notable, one, because it's very deep, and two, that it's very broad. It's reached over 4 million people across a variety of initiatives. There are 14 CARD community clinics. These are nonprofit clinics in remote areas that provide free or very low cost medical service to members and non-members. They've served 280,000 clients just in 2019. There are community health days. They have established a Boticard pharmacy, which is to provide poor and excluded communities with quality controlled generic meds. There is a card laboratory, which provides lab services for card clients, staff, and their family members. There is a card e-doctor for online consultations that run webinars by medical professionals, live discussions, Q&As on family planning, pneumonia, COVID, diabetes. And then there is integration with financial products. So it's a credit with education on health, offers health-related discussions during the center meetings, the traditional microfinance meetings, and they get discounted consultations as clients as well with private providers. So there's a lot there, but that's because it's an extremely big and broad initiative. What do you think, Olga?
Yes, Sam, I completely agree. The outreach of some of these MFIs is just phenomenal, isn't it? They get everywhere. There's so many clients being served. It's just really impressive. But I think this is your typical, really holistic program. It covers most angles. They've built really nice partnerships, more at macro level, so national level. And I think this is because of the outreach they actually have. It's kind of fundamental to the type of health products that they're able to provide, and their extent and also the quality of them. And I also like, particularly from this project, the program product, the bit in which they involve the community. So it's open. Some of their products are open not only to clients but also community, to other members in the community, and they have this referral system for others which can also receive the program product. And I think that's quite interesting, because more than a client approach is like, because we have this bigger reach, let's transform the communities, and I quite like that. Yeah.
Chiara?
Yeah, I agree. I mean, the outreach is impressive. I mean, the health programs reaches 4 million clients. I mean, it's kind of unique. Another thing that I found extremely interesting, I mean, in the Philippines, it's difficult to reach all the areas because of the geographic setup of the country. And the pandemic has been especially hard there, and lockdown has been extremely long. But they took advantage of the technology and the widespread of social media. I mean, social media are very frequently used in the Philippines, to develop their health program around that and adapt to the circumstances to allow clients to still receive consultation through a number of platforms. And the e-doctor solution, again, is extremely interesting because meet a client need with the technology you have available and takes the maximum advantage of what is there, and to, again, continue to deliver the service.
And they do so much that I actually realize I missed out a key point from that lengthy summary, which is they also have the insurance program. They're called Kasapi, in partnership with PhilHealth, and they also provide loans for the premiums, which is not uncommon to do this because sometimes upfront premiums are unmanageable, and perhaps an insurance provider doesn't allow a monthly or definitely not weekly premium payments, but yeah, loan for premiums as well. Yeah. Anything else either of you want to talk about here? I mean, for me, it is the breadth of this initiative that's most striking. And of course, it's a bit of a circular point, because you need to have a big organization with resources and big outreach in order to have a big program. So if CARD's health program were a tiny little pilot, it wouldn't be very impressive. But by the same token, you couldn't expect a small NBFI to have something like this. But it still takes courage and vision to actually do this over a long period of time and reach millions of people, doesn't it?
Absolutely, require commitments and
yeah, that's right.
Exactly. Some smart thinking as well about who to partner with, how to fund it, like for a continuous time, continuous period of time, lengthy period of time. So yes, no, very good.
Right, and these partnerships don't get established in a single meeting, do they? Let's partner. Okay, it takes weeks, months, sometimes years of building to get something off the ground. So that, yeah, that is very very impressive. Liked that a lot. Let's move on to a very different initiative, and that's Friendship Bridge in Guatemala. If my slides will, there we are. I like these photos. And Olga, you're going to give us a bit about Friendship Bridge.
Yep. So Friendship Bridge is a cooperative in Guatemala. They started in 1998, and their main mission is to empower women and support them to have a better life. A little less than half the clients are based in rural areas, so they have a big coverage in rural areas and remote. And as you know, Guatemala has one of the most unequal income distributions in the world, and women are far less likely to be given education, access to healthcare, and other opportunities. And this is particularly true for the indigenous Mayan women. And in terms of the healthcare situation, there is no real universal coverage, although they are trying really hard, but at the moment it's not real, it's not happening. And the access to healthcare is one of the main challenges experienced in particular by this type of Friendship Bridges borrowers, these women who are based in rural areas and pretty deprived. So Friendship Bridge sensed that health was one of the most important aspects, the key to female empowerment. And back in 2015, they launched their flagship program called Health for Life. And this health program is embedded into the organization's strategy, and they monitor performance and everything else. And with this context in mind, the Health for Life program was set up in partnership with the Maya Health Alliance, so that all the services provided in the health clinics were provided in both languages, in Spanish and one of the Mayan languages. And this partnership also implies that the services offered are in line with indigenous cultures, with indigenous way of life. Again, they focus very much on having female doctors or female healthcare professionals, nurses, proximity as well. They avoid travel for the clients, so they offer them in rural areas. And then they have a focus on health education and prevention, which is also really important for these, communities that are pretty remote and stick to the ways of living. They're very traditional as well. Medical care is provided through mobile clinics that go to the villages. And then with COVID, they've started promoting a door-to-door approach where nurses just visit the clients. And they've also started telemedicine. So, and then clients need to meet particular requirements in terms of loan cycles, repayment, prior use of healthcare services, etc. But others who don't meet those requirements have also access to the service at discounted rates. And they can access a wide range of medical tests, screening focused on diabetes, hypertension, breast cancer, and cervical cancer as well, which are the main causes of death. So a very comprehensive, holistic program. Yeah, very well tailored.
That's right. Also in part 3 of the paper under delivering healthcare to those who need it most, I think really for that sort of the sensitivity to the needs of the Mayan communities, right, Chiara?
Yeah, I fully agree. I mean, the bilingual, the fact that the language and designing services that are, again, culturally central for the client is quite interesting. And again, meeting the client needs, working around the linguistic barrier is kind of unique. And it's something we've witnessed here, but also Dream Development said the same when they deliver their service in Thai, English, Khmer, and Burmese, is a way to reach the client. I witnessed that on my skin. When you deal with a medical or with an hospital and it's not your mother tongue, it's more challenging and you are less comfortable. And this institution that cater the needs of their community is really something unique. Another thing that I really like on Friendship Bridge is the quality control they do. There is strong emphasis on KPIs and looking at the partnership and see how they can improve with a constant monitoring on the quality of the service delivered. That is, again, something that makes the program successful.
Yes. Let's stay with a women's focus and go to Jordan, and that's Microfund for Women. And I'll give a little summary here. This is Jordan's largest nonprofit MFI, serves over 124,000 clients. In Jordan, health emergencies are among the first 3 common reasons that cause huge losses to micro businesses in the country, leading to household over indebtedness. And the and to help clients, business clients, largely deal with these health emergencies, MFW's healthcare program has a wide variety of financial and non-financial components. There is a bundled credit, life, and hospital cash microinsurance product, maternity loans, insurance-linked savings accounts, a telehealth mobile application. I think you can see a marketing bump for it there on the screen. This gives access to consultations from doctors, consultations and medication, and then awareness lectures on everything from breast cancer, nutrition, first aid, all the way to smoking cessation. The insurance product is called Aftayuna. This is a simple policy model, one-stop shop type coverage, which bundles the credit, life, and the hospital cash insurance alongside the other financial products to cover medical expenses of clients, spouses, and children up to 21. And the program also has life insurance coverage in case of the death of the borrower and or their spouse, and clients and family members are eligible for an allowance of up to about 18 euros per day equivalent of hospitalization for up to 24 consecutive nights and up to 36 nights within a year. So, Olga, what's interesting most for you about this?
Yes, so again, it's about the outreach, how big the program is. It's similar to Alamana as well, in the fact that finding a health product that works, a health program that works in this context is hard. And I think, you know, the take up of the health insurance is impressive, and the way in which they're responding to the needs of the clients as well is quite good. So yes, I quite like it.
Chiara?
Yeah, I like the convenience of the service as well, like Alamana. I mean, you can directly address your claims at the branch. There is quick, is accessible, increase the uptake inevitably. So it's a very good approach.
Yeah, a bit similar to Alamana, right? In this, you know, the first one we saw, and both in the same section of the paper for that reason. But yeah, for me, it's the bundling. The clear intention to make insurance as simple as possible. Insurance is the hardest to understand and most frightening financial product for a lot of people, and particularly in Muslim countries where there is the possibility of interpretation of insurance as gambling and therefore prohibited. And to make it a simple bundled policy is, I think, very impressive. Let us go to the last of the 7 now in Argentina, and that's ProMujer Argentina. And Chiara.
Yeah, thank you. So ProMujer Argentina started operation 2005. They offer financial services, healthcare, and education. And they work in the 3 of the poorest and marginalized region of Argentina. And they realized that women are highly exposed to health risks like overweight, but also hypertension, diabetes. And again, they also witness gender-based violence. So they started a program that is called Beneficio Universal, which is a primary healthcare service available to all their clients. So the moment you enroll in the program, you are entitled of a basic screening that is done directly at the branches. And if some illness is detected, you are referred to a network of specialists with whom ProMujer partners with. If again the specialist cannot solve the issue, the client is kind of scale up to the public health system, and they have means to allow the client to enter the public care faster and then be treated. And what I liked about this program is the different layers they have in order to again serve fully the needs of the client, but also the very articulated strategy they developed for the entire ProMujer group. I mean, health and microfinance have always been at the heart of ProMujer intervention, so it's kind of expected from them. But the strategy is really comprehensive, very clear, and it outlines how they plan to deploy enhanced health care across the entire region, which is kind of amazing.
You're on mute.
Sorry. Olga, do you want to add something on that? No, now you're on mute.
Sorry. So as Chiara was saying, ProMujer is kind of expected to go with health, to go with a health program, but I like the way in which they do that. It's very much tailored to each country, to each program of ProMujer. And I think in Promujer in Argentina, it's more about they've established a lot of partnerships to deliver the program, but the partnerships are kind of local. So, for example, one of the star characteristics of this program for me is the fact that they get fast referrals and they put people into the public health system. Because Argentina can afford to do that. So what they do is they actually link them up. Like, this is too complex, this is too complicated, too expensive for us. We cannot treat this, but I'm going to link you up. I'm going to refer you to the public health system. I think that's a fantastic thing, but I think that can only be done if you have, your networks very well established at the local level, and you've thought through very well who you're going to partner for which type of program or of need of your client. So I would highlight that, how it has managed to kind of fit within the context very, very well.
Yeah, and it's part of their strategic plan, isn't it, Chiara? There's a long-term vision here for its rollout.
Absolutely, and I would like to quote something from the strategic plan that says, "If others can do better, Promujer will partner." So it's very conscious and very looking forward. You can do the things you are good at doing, but if there is someone else that can do it better, we partner up and we deliver a better service. And this is kind of
right.
Visionary.
We won't. Yeah, don't be territorial or proud. As long as you're providing the best thing you can to the most clients, then yeah, I like that as well. All right, let's move on to the overall factors for success now. In this paper, we start this section by identifying that the need is really at three levels, right? From high to low level. And the needs vary by country, which have different healthcare systems and capacity, resources, and priorities. And then groups have particular or varied needs. Children have needs that are different from men and from women, migrants, the elderly, remote communities, even intravenous drug users. One of the applicants has a small program specifically on Hep C testing for them. But they all require unique and specific care. And then going down to the level of the individual, no two people anywhere in the world have exactly the same health needs, and they have their own challenges that need to be met. So somehow effective healthcare has to achieve something that's seemingly impossible, right? It has to be both general and specific, and it has to be one size fits all and also somehow bespoke. I mean, this is hard enough in rich European countries. So the mind boggles at how it's achieved in countries without those resources. But so we as a team over the year have thought about some of the factors for success that we've noted from not just the 10 semi-finalists, but all of the 43, but particularly the 10. And on the screen here is a few points that are expanded on in the paper. And I won't go into them deeply here, but partnerships and linkages, we've heard several just in the last half an hour of examples of that. Needs of women is virtually a constant, right? The needs of women as a group have particular needs, but in their roles as mothers, as business people, women-specific diseases, this is something that we see throughout the applicants. The best applicants is a focus to one extent or another on women. Examples like Avanza and Friendship Bridge really show how you need to overcome structural barriers and norms that can get in the way of people accessing healthcare, even if they can afford it. Integrating education and wellness building into financial products, we've seen regularly. Innovating with technology is something that's especially been catalyzed in the last couple of years, really through need, and part of a broader catalyzation of digital financial services because of the pandemic. But, e-consultations, I think probably these were very rare 2 and more years ago in the kinds of segments we're talking about here, and then integrated and holistic models. But the last point here is the one that isn't like the others, because all of these require ambition to some extent. They require an investment of resources, risk taking, and not just doing the easiest thing, which may be sticking with boilerplate microcredit products. So those are some of the things we noticed. These are the gold standard of healthcare, and I'm gonna stop sharing the slides here and ask my two friends, panelists, what over the year as a whole, what struck you the most as distinguishing excellent initiatives, replicable initiatives from those that are less so? Chiara, do you want to go first?
Yeah. One thing I really like, you should have a plan, and you need a clear strategy that is long term, and you also need to look at sustainability of the initiative you are developing. And all the organizations, the majority of the organizations that made to finalists, and semi-finalists, they had this kind of plan in place. I mean, Promujer, Azei, Friendship Bridge, Avanza, Solido, all of them had the healthcare as part of their strategy. It's not a CSR project you have on the side that has some grant money and finishes, but it's part of the entire operation. And another thing that is important, you don't only need a strategy, but also you need to do an ongoing monitoring of the progress you are making in order to adjust the strategies, because one thing doesn't fit it all, and your needs might change over time, like telemedicine. That is something you would have think about a few years ago. So what I really like is this constant monitoring of the progress, having KPIs to see where you're going, and tweaking the services to be day by day better in order, again, to cater the needs of your client in a more comprehensive and holistic manner. And this is kind of unique and very, very nice to see.
Olga, same question to you, really.
Yeah, so I've been quite struck by the in-depth understanding of every one of the MFIs that have applied to this award, about the risk of making wrong assumptions. So I think all of them are very well embedded into their communities. They have their client needs top of their minds, and they try, some of them more actively, some of them through different ways, to be kind of community-led and assess exactly what the clients need. And from them, they tailor their health programs, so very much adapted to the context, even though they've got features that are scalable, that they are replicating from others, but it's like very much with their type of client in mind. And I think that's fantastic, because that takes a lot of energy and resources from an MFI to actually start designing these products. So I also like the fact that a lot of them were partnering not only with private clinics that were offering particular services and they were ready to subsidize to their clients, so at a very local level, but also with bigger actors that are out there kind of looking for potential partners that have the scope or the reach to the type of population that microfinance clients are serving. So I think that was really good. I think the way in which they are understanding the context of the country. So for example, some of them will know that there is a conditional cash transfer program operating that requires, for example, cervical screening tests. And what they do is they kind of partner in the field with some local actors through a national, authority. So it's just really good, the amount of effort that most of these organizations are putting into creating the appropriate partnerships that will benefit the clients ultimately, but also the healthcare systems and the capacity of the national healthcare systems, which is also not negligible.
Yeah, and sometimes it has to be barrier specific or barrier responsive, doesn't it? Right? Because the barriers aren't all the same here. Sometimes it's an access barrier, just about getting products to people who live in extremely remote areas, and sometimes it's a cultural barrier, and sometimes it's about that there are services but they're of insufficient quality, and it's about quality assurance. So you've got to adapt it specifically to what those barriers are. That's one of the things that struck me. I mean, and as I think you've said, the cervical screening is not always about just, are there doctors around to give screenings? That's not just the thing that stops women doing things, particularly if they are of things that are, culturally or sexually sensitive. One thing as well is not just limiting services to clients, or at least clients in the narrow sense of microfinance clients, borrowers, but to families. And then some of the ones we've seen are really looking to expand beyond, to sort of separate out the integration with the financial service by saying you don't need to be a loan or you have a savings account with us. But the most important thing for you is to have access and for the services to be quality and more affordable. So somehow get economies of scale, right?
Yes. And it's also, they're being quite smart about how they fund them, which makes them, you know, lengthy over time. And I think that's also really important, because one of the things that happens with non-financial services, and it happens a lot, unfortunately, is the fact that they are not very, they don't last. They start, they're piloted, then something starts, and then you run out of money, and then you quit. And I think most of these programs are, as Chiara was saying, they have a plan. They know how they're going to fund it. They're not going to run out of money. They're making the appropriate partnerships. And I think that's really, really important, particularly with health, because it's about creating trust to use the services, be it microinsurance or cervical screening test or whatever. So once they have the trust, if they disappear, it's just so bad. So the fact that they're continuing to be there, they have a plan, it's part of the strategy. That's absolutely, you know, fascinating. And I think that's one of the biggest features of these programs.
Are there ethical concerns here, Olga, on if you're trying to, you know, playing God to an extent, trying to roll out treatment services that may be life-saving to people who have nothing, and how do you make the decisions of who gets them more affordably, whether it's just clients or family members, and this is tricky.
It is tricky, Sam. It is tricky, particularly because sometimes these services overlap with services of the public health system, that they're offering the same thing. Or so some of the ways in which these institutions are funding them is coming out of their own portfolio, their own profits, and they add it to the interest rate. So the requirements are in terms of how many loans have they got with us, is there delinquency, are they paying okay? Have they already used the service in the past with us? So those would be requirement criteria, which to me makes sense, because sometimes that we were saying is not about access, it's about better understanding culture differences or hand-holding until they get the first screening. And they might do so with, you know, with somebody from, say, literally walking them to a private health clinic and getting a subsidized price. But then the next time they might do it in the actual public health service, if they've got a community center there, they would do it there. So sometimes it's not really about access, it's about being treated appropriately, seeing a female doctor, somebody hand holding you and taking you with them and telling you, well, this is what it is that you see, it's not that bad, and explaining to you the results and all these things. So to me, price is not the biggest issue. I think the fact that access is there, and also a lot of them, so the services are usually not restricted to others. So clients would get, so, you know, like, for example, the clients that meet particular requirements would get for free these services, but the others that don't, they would get subsidized discounts, right? So they would also have access to these private clinics at a subsidized price. And then there's the other ones who have decided, the other MFIs who have decided to give them free for everyone. So, you know, I think both ways of doing it, particularly if what they are doing is ensuring the financial sustainability of the product is really good and acceptable.
And Chiara, I wanted to ask you something. You, like us in the e-MFP team, have seen the applicants from round one, the 43 that apply to. So there are a lot that don't make the cut for the semi-finalists, but some of them are really interesting too, even if for whatever reason didn't make it all the way through to the end. Are there any examples that you found fascinating that probably deserve a wider audience, even though they're quite different than the ones in this paper?
Yeah, absolutely. Yeah, unfortunately, we couldn't fit more in it. But yeah, definitely a couple, especially in Africa, both of them, with a very strong technological component. One is Shelf Life, that is field intelligence. Is a program that the owning company is a German one, but the operation are in Nigeria and Kenya, and is a pay-as-you-sell utility pharmaceutical inventory. And actually, they solve the problem of inventory by bundling, by data-driven planning, asset-light fulfillment, and allow for consolidated purchasing and consignment financing into a single subscription. So they actually deliver very high-quality medicines to the different pharmacy in Nigeria and Kenya, which is something that sometimes is overlooked. I mean, in the cities and also in the semi-urban areas, you have these pharmacies that have a number of products that are expired or don't cater the actual needs of the community. And with a very strong technology and with a very wide network of operation, they manage to deliver these products to the pharmacy and control the inventory in a way that is the same way that is done in the Western world, but is very much needed in this community. You don't need to travel to reach your quality services, and it's just there, and allows again to reach those communities that might maybe just need access to pharmacy for covering basic needs like diarrhea for kids. That can be a health-threatening disease or can be a lifesaver getting access to drugs in such a fast way. Another one is medical concierge. They operate in Uganda, Kenya, and Nigeria. And again, there is a strong tech component because it's a private digital care company, and they provide 24/7 health consultation. It's teleconsultation, of course. And they have, again, strong partnership because they have health professionals that provide video, text, and they reach the last mile delivery and provide also pharmaceutical supply. They have mobile laboratory, pick-up location for clients. They make it convenient and accessible to a demographic that otherwise would be left behind for sure, or would struggle to reach a consultation. And this is quite fascinating. I mean, also the creativity in the product design in order to reach the demographic you want to reach in an affordable manner, which is also quite important.
Yeah, I remember those two. And then on the last one, yes, it does reach a different segment, a middle higher income segment, but important. And the inventory management, which is one of the biggest barriers. It may not be a sexy subject that attracts the interest of grant committees, but ensuring inventory in pharmacies is probably as important as many other things in the sector, isn't it? One last question to you both with a short answer, please, is after this year, we spent a lot of time on this subject, haven't we? I mean, you and I, Chiara, are more new to it than Olga perhaps, but what are you optimistic? Like, is this sector in good shape? Olga, go ahead.
I definitely think so, particularly because we have proof now, because after COVID, seeing how all these MFIs that had strong health products ongoing have performed is pretty much fantastic. A lot of them have become really innovative. They have been able to offer telemedicine services really fast. They are, they've adapted their products so fast to a very different context in terms of we cannot visit anybody. And I just thought it's been fascinating how they've dealt with the COVID period and how they've adapted so fast and so efficiently, really. So definitely, I'm optimistic, Sam.
And Chiara, likewise?
I agree. Yeah, likewise. Let's keep in mind that most of these programs have been in place already before COVID, and since the pandemic, I mean, health has become a central topic. I see that they can only scale up because there is growing interest, and the program can just be expanded, and we witness the severe expansion and creativity in order to, again, meet the needs. So
couldn't agree more. Okay, we'll finish there. thank you both for the whole year, really, of being involved in this, but thank you for taking part in this session. Thank you to attendees for coming. The paper is in the link, and it's also on the conference side, and it's on the EMFP side. Without sounding self-serving, I commend it to you. It's a very interesting tour of the current landscape, with some fascinating initiatives in there. And enjoy the rest of the conference, and thanks once more. Goodbye, everyone.
Thank you.
Bye.
Thank you.